Peptides. Science, hype, or medical panic? Something very interesting just happened at the FDA, and if you've been on social media, you've probably seen two completely different reactions. One side is celebrating. The FDA finally approved peptides. The other side is acting like the FDA just opened Pandora's box. Well, both sides need to calm down. First, let's get the facts straight. An FDA advisory committee recently recommended that 6 peptides, BPC 157, KPV, TB 500, MOTS-C, Semax, and Epitalon be eligible for pharmacy compounding. That's important. But technically, this is not the same thing as FDA approval of these peptides as drugs. The recommendation is also not the FDA's final decision, and that distinction matters. Now, why is this becoming such a huge controversy? Because peptides have exploded in popularity. They're being investigated or promoted for everything from wound healing and tissue repair, inflammation and metabolic disease, to obesity, neurologic disorders, sleep recovery, and longevity. But here's where we need intellectual honesty. The evidence is not equally strong for all of these peptides or all of these claims. Some have human data. Some have very limited human data. Others are supported predominantly by preclinical or animal research. And for several of them, we simply don't have the large, prospective, randomized clinical trials that we'd like to see. That's a legitimate scientific criticism. But here's where I think medicine sometimes gets it wrong. Lack of definitive evidence is not the same thing as evidence that something doesn't work. That's why we do research. And there's another reality we can't ignore. People are already using these compounds. They're buying them online. They're getting them from wellness clinics. They're obtaining products of uncertain purity and uncertain manufacturing quality. So screaming "don't use peptides" isn't necessarily solving the problem. It may simply push the market further underground. I'd rather see something different. Regulation, quality control, physician oversight, adverse event surveillance, and serious prospective clinical trials. That's why I think moving this discussion forward is reasonable. But I'm also not joining the peptide fan club. I don't believe every claim made by influencers. I don't believe that because something is called a peptide, it's automatically safe. And I certainly don't believe that animal data magically become human clinical evidence. What I reject is the idea that we have only two choices: blind enthusiasm or complete prohibition. There is a third option: responsible scientific investigation. So my message to regulators, physicians, researchers, and patients is simple. Don't worship peptides. Don't demonize peptides. Study them, regulate them, measure the outcomes, and then let the data decide. This is ID Rounds with Dr. Ganoni. If you want medicine without the social media tribalism, subscribe, because we have a lot more to talk about.